Hey everybody, what's going on? Welcome to BFR Tuesday. My apologies for being a few minutes late here, just scrambling in the clinic with some patient care. I am here to answer any questions regarding blood flow restriction training. I had one question via email today, so if I don't have any questions from anybody that's online, then I will answer the question that I got today and then be able to post that. So if you have a question, just throw it in the type message in the upper right corner under chat. Like I'm going to put in hello, Alice, and you can pop any question up there and then I will try to answer it. Oh, thanks, O'Connor. I appreciate that. I'm, just kind of my take on BFR and my experience and my thought processes around the need to improve our resilience, I guess, to what life throws at us. Yeah, if anybody wants to grab a copy of the book, it's on Amazon, both written. It's also, you can do an immediate download, and then you can also get an audio book as well. Yeah, the story is pretty interesting. I mean, it's been a long journey to where I'm at. Getting into rehab from injuring my knee pretty badly is it gives me, I think, a lot of compassion for my patients and trying to understand what they're going through both physically and mentally. All right, if I don't have any questions per se, the question I got today via email was regarding low load causing hypertrophy. So low load is defined as 20 to 35% of one's 1 rep max. So it's pretty light load. And the common thinking up until about 5 years ago was that the only way to cause strength and hypertrophy changes was from using heavy load. So heavy load training, meaning like 65 to 90% 1 rep max. That's how we define high load. I was part of, not part of the study, but part of TRX training when they did a study or had a university do some independent studies. And they wanted to see if could you use body weight exercise using a TRX suspension trainer and cause strength and hypertrophy. And us old school exercise physiologists thought, no, that's not possible, because what we were trained was that you had to lift heavy loads, cause damage to the tissue. The body responded to that damage and was able to gain strength and hypertrophy from there. And if you use light loads, you weren't able to do it. What we found with that TRX study, and has been validated since then, is light load body weight exercise, or 20 to 35% of 1 rep max, can cause strength and hypertrophy. But you have to take it to failure, or at least 1 repetition or 2 repetitions to failure. So you're going to be taking light load all the way to failure. The risk of that is more exercise-induced muscle damage. Anytime you take tissue to failure, you're going to risk exercise-induced muscle damage. So it's not a great alternative for people that cannot tolerate heavy loads, just to use light load all the way to failure. When you use BFR and light load, the advantage of using BFR in conjunction with light load, even though you might get the same result, light load versus light load with BFR, the amount of reps necessary is going to be about 50 to 75% more. So if we're doing 75 reps with BFR, it might take 125 reps without BFR, which would be a lot of reps. So BFR allows the reduction in time and early stress to the tissue metabolically and also tensile, even though the loads are low. So yes, you can gain strength and hypertrophy with low load training, 20 to 35% of one's 1 rep max, but you're going to have to take it to failure, and it's going to take a lot of reps. And if you're risking additional exercise-induced muscle damage by going all the way to failure. So any questions around that? All right, awesome. Well, if there's no other questions, I'm going to sign off. If anything comes up, feel free to reach out to me. I'm Dr. Cara at bfruniversity.com or on any of my social media, just under Ed LaCara. And that's it. I will see you next week. Next week, we have a short week because then we have Thanksgiving here in the United States. But I will be on next Tuesday, which will be, looks like the 23rd. All right. Thanks so much. Have a great day. Bye for now.